Hello.
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 What is your name and occupation?
Hi, my name is Monica Garcia, and I'm a registered dietitian and certified diabetes care and education specialist.
Okay. How did you become interested in working with diabetes?
Well, it started with my father. He was diagnosed when he was 55 years old. I was going to college already to become a dietitian. Then, during my practicum, I was working with children, so I stayed working with pediatrics for the first 9 years, and after that, I came across an opportunity to work at the Diabetes Management Center of the Rio Grande Regional Hospitals. So that's where I became a diabetes educator for 9 years. And then now I've been working for the past 2 years at a dialysis center, working with mostly patients with diabetes that didn't take care of themselves really well. So now they depend on dialysis to stay alive.
Mm-hmm.
Okay.
What are some common misconceptions about diabetes that you often encounter?
Well, as a dietitian, I'm always like talking about food, how the meal plans, like how to, I tell them how to carb count. I teach them what foods, what products to buy, and the misconception that most of them have is that they can't eat anything. So that's what they complain, right? Like I can't have anything. I cannot eat tamales anymore. I can, but actually they can have everything. It's just in moderation and portion controlling. So I kind of like teach them about that, like to make sure that they don't feel like, that's it. Like they cannot no longer go to family gatherings and eat like regular food, just like their family.
Yeah,
Okay, yeah.
we recently interviewed like our teacher at school who has diabetes, and she said the same thing, that it's just about smaller portions.
Yes, yes, definitely. Portion control sounds simple, but it's kind of difficult when we're used to, in our culture, have like this huge plate of food served by our mothers or grandmothers, and like if you don't finish it, then it's not good, right? You have to finish the whole plate, and the portions are big at the restaurants because then people don't go back. As a customer, they want a big plate, and so that's where the problems arise because of the amount. So that's the key, basically, that when we eat too much, is just too many calories, which ends up getting all of these extra calories. It gets stored as fat, and that's also part of the insulin resistance that is created by this extra weight. So pancreas is trying to constantly produce extra insulin until it's kind of like, okay, this is too tired, right? These beta cells start to decrease, and that's when you start getting the high blood sugar levels because of the obesity.
Mm-hmm.
Okay.
Yes,
The
thank
next
you.
question is, what are the biggest challenges you face in your work with diabetes?
Well, I think working at the Diabetes Management Center, the big challenge was just the economic situation that the patient have. Is usually cheaper to eat foods that are not really healthy for you than to buy something that is healthy. Just the they don't like, actually they can afford to go buy healthy foods, and it's very also easy just to go and get some fast food for
Yes.
cheaper price. So that's, and also these persons, they don't have like access to healthcare. So it's expensive to have a medical insurance when you are like at a younger age. So when you can actually get insurance and it's paid for by government, is still Medicare. So that will be until like your 65 years, so or older. So what ends up happening is that by then they already have the diabetes, or maybe they've had the diabetes for 12 years already or more, and they didn't even know because they never had access to healthcare. So, yes, it's just too late for them, and it's just, yeah, basically that they don't have the economic resources. Um, there is programs available that they can go and get education, or like they can go and see a doctor for free, but most of the time they don't know about it. So it's just the awareness, or like, okay, where can I go? They just, or they don't have the transportation to be able to go to these places, and so it's just yeah, it's difficult for them.
Thank you.
Okay.
Can you tell me about any recent advancements in diabetes management?
Yes, well, and once again, any advancement comes with expense, right? So it's more expensive. So the people that get benefits from these advancements will be the ones that have a good insurance. One of them will be like the continuous blood monitoring. That's called CBG. So continuous blood monitoring. So that means that they wear like a patch,
Yes.
and it stays for 3 weeks, and it monitors the blood sugar levels day and night. So then they have a device that is gonna sound alarms in case like the blood sugar level goes up or like too low. Yeah, so it will let them know how they're doing, so they can treat, depending on what they have. If they have a higher low blood sugar, the treatment is different. So they have it's like making a blind man see when they are on a blood glucose monitoring device, because then they can see, okay, what happens when I eat these 2 slices of pizza. They can like see it real life, and then say, oh, okay, I'm not gonna do that again. So that's one. Then, well, the insulin pumps are also becoming more available for patients that have the type 2 diabetes. So I see now that more patients use it, and before it was exclusively for patients with type 1, which is the insulin that they don't produce any insulin at all. So, but now I also see it a lot with patients on with type 2 diabetes, and I get, okay, I ask, what's your hemoglobin A1C, right? And that's the blood sugar level for the average for the past 3 months for this patient that I saw with type 2 diabetes. And he told me 4.9. I'm like, oh my God, that's like getting better than me. And that's because he's using both the insulin pump and the blood glucose monitoring device. So it's just like having an artificial pancreas, per se, when you have an insulin pump, because it gives you insulin depending on what you're eating, and it's just controlling your blood sugar level every day.
Thank you.
Okay, thank you. Okay, the next question is, how do you support individuals with diabetes in their daily lives?
Well, as dietitian, you focus on the dietitian and certified diabetes care and education specialist making an individualized plan. So you want to tailor to them based on what their needs are, like individual needs. So for somebody, it may just be getting a supplement, help them. For somebody, it can be give them a grocery list so they can know what was to buy. So other persons, they want to know what products to buy, but the other person is not gonna cook, so they want to know how to count when they go to a restaurant. Yes, sometimes they need help with scheduling of the meals. So we find a solution on like the timing of the meal. So we plan based on their needs. They say, well, I don't have time for breakfast. Like, okay, how are we going to do these and snacks? And so scheduling. So it depends on the patient. So yeah, that's the key, that it has to be individualized. But it's not like a set for everybody's the same. It's just different for everybody.
Okay,
Thank you.
thank you.
What advice would you give to someone who has recently been diagnosed with diabetes?
Well, you want to find the best healthcare team that is interdisciplinary, meaning that it's not just the doctor that's going to take care of the diabetes, but you want to get the right team so to work for you. It will be the doctor being the one that is going to say what medications to take and how much, but you also need in your team the dietitian, for the meal planning and portion, like carb counting and just doing the food part. And then you also need help from like for behavioral modification. You want to get help from a counselor per se, or like a psychologist, because sometimes it's difficult to accept. They say, no, I'm just going to do this for a little bit, and it's just hard, and then it's going to go away. So they always have the hope, and the diabetes is something that if they take this medication for a little bit of time, or like they follow this diet, they lose weight and it's going to disappear and it's going to go away. Mm-hmm. But it's just hard to accept the fact that it's a disease that will not go away, and so that's why they need the counselor, somebody to help them. It just goes together. So it's a matter of looking to somebody that you're gonna be comfortable with and it's gonna work with you, because sometimes a doctor is not gonna be the right one for you. It depends on how you every person, like I said, is feels okay. But yes, those three are basic for the diabetes care.
Okay, thank you. So, what are some of the most effective strategies for managing blood sugar levels?
I think planning, having a schedule, it helps to have a set schedule for meals, and the carb counting, make sure that you don't go over buying the low glycemic index foods. That's not going to spike. So you don't want to have like sweets right all the time, or regular sodas, and that you do away. So having the schedule, having the right foods, and sometimes people say, well, I'm going to not eat. They want to skip meals, or they don't have time, or only eating once, but no, actually eating more often. So like the 3 meals, 2 snacks, and it's a good way, to control the blood sugar levels, and to distribute those carbohydrates, which is what causes the high blood sugar.
Yes. Okay. And finally, what are some common complications or long-term effects of uncontrolled diabetes, or like unattended diabetes?
Well, heart disease is what gets them most of the time. Yes, heart disease, and the kidney disease also, because it will be affecting all of the little veins, all of the, it's just also like eye problems that they get. So the blindness and vision. Yeah, those are the big two things. But yeah, everything basically your body gets affected. It's just, I tell my patients, it's like if you put, instead of gas, you have sugar in that tank. So what's going to happen to your car is going to all of a sudden just not work, right? Mm-hmm. But with us, it takes years and years and years with this sugar in the blood instead of gas, right? For it to get damaged, but it will catch to you. So everything in your body gets affected, because even like a small cut can become a huge problem when you have a high blood sugar level, because it will not heal. So it's just gonna get infected, and then they start with the amputations, and so yeah, it gets really complicated. Then you get the complications, and then you start seeing them slowly appearing. But then they say, well, all of this started to happen all of a sudden, everything, and then it's not all of a sudden. It took years and years of not adhering to a meal plan, to your medication regimen, exercising. So it's what it takes. But sometimes the patients, they don't want to hear it. They want to, oh no, it's because they told me to take cinnamon. They want a quick fix and something, a pill, mm-hmm. And that will solve the problem right away. But it's just what it takes, just exercising, eating a healthy diet, and just going to see your doctors so that way the blood sugar levels are managed, and that way the complications, they don't happen. Or if they happen, they will take many years, and they can live a life as long as somebody that doesn't have the diabetes.
Okay, yes.
Thank you so much for tuning in today.
Thank you so much. Yes.
Thank you for
You're welcome, and I hope you do really well.
You too. Thank you.
Yes. Thank you.
Bye-bye.
Bye.